So here's our agenda for this evening. So we'll this is what we'll be working through. Okay. And I actually may have changed up the order just a tad, but just in case you haven't heard about us, I think most of you on the call have, but again, we're Partners in Health and Wholeness, an initiative of the North Carolina Council of Churches. And the North Carolina Council of Churches was founded in 1935, so almost 90 years ago. And the initiative, the Partners in Health and Wholeness that Stephanie and I work on, was founded in 2009. And as you all know, if you've worked with us before, there's a lot of different health areas that the Partners in Health and Wholeness work on that include healthy aging, healthy eating, mental health advocacy, opioid response, and tobacco and nicotine education, just to name a few. And we work to build bridges with faith, health, and justice, empower faith communities to improve their health and well-being, and partner and support grassroots efforts to challenge injustice. And we do it by providing resources, connections, and support to faith communities for their health initiatives. We work to establish trust and partnerships with our faith communities. And when available, we do offer many grants for financial support for faith communities' health initiatives when funds are available. And so I want to talk for a second about that as well. So we do it because we believe all people are loved by God. We believe that God cares about wholeness of humanity and community, mind, body, and spirit, and that our work in partnership with faith communities will improve health outcomes across the state. And so this is our Partners in Health and Wholeness team. And like I said, Miss Stephanie is on the line with us tonight. And then we have Reverend Dr. Arlisha Simmons, who works in the eastern part of the state, and Reverend Carolee Hall, that works in the western part of the state. And then Krista, who specifically works on healthy aging. And she's going to be doing a webinar next week, I believe. So that should be in your newsletter. So really quickly, we are still accepting until the end of this month mini grant funds for your tobacco initiatives as part of your health ministry. So if you don't already have a collaborative pledge on file, if you haven't done that in the last year, in the last 12 months, you can do that. And Stephanie is going to put in the chat the link where you can go fill out a collaborative pledge, because we have to have a collaborative pledge from you before you can apply for a grant. And so the collaborative pledge needs to be done by April 23rd, and then we need to have your grant by April 30th. And so the second part of that is if you're eligible for a grant, which means if you haven't already received a grant in the last 12 months and we have your collaborative pledge has been accepted, then after that you will get an email link to the grant application. And I think I already talked about that. And then, so lastly, you would just, once you get that link, you just apply for it and have it submitted by the end of the month. And so here are a few things. This is just an example of some things that you can apply for when you're putting your budget together. And of course, I can always help you with that as well. If you want to give me a call or send me an email, I can help you work on that budget. But you can do a town hall meeting or a forum. You can buy tobacco-free signage if you put a tobacco-free policy in place on your campus. You can do specialized training like tobacco treatment specialist or Catch My Breath training, which is a youth vaping cessation program. And you can even promote our North Carolina Quit Line program, which is a cessation program as well for adults. And even throughout the year, as funds are available, they can at certain times throughout the year provide, if the person qualifies, provide free nicotine replacement treatment, which is lozenges and patches and gum, the nicotine gum, things like that. So those are just a few ideas. And again, I can get with you and, help you with that as well. And if you have any questions about the application process or the collaborative pledge, this is Stephanie's email, and she'll be the one that can help you with that. So feel free to reach out to her. And I am still providing tobacco, nicotine education workshops as well as opioid workshops, opioid response workshops. So the tobacco and nicotine education workshops, if you can reach out to me about that soon, that would be great. And then we can do both, or we can do either. So you can reach out to me if you're interested in either of those things. And Stephanie just put my email in the chat, so you have that. And let's switch over to we have Mr. Ray Reardon with the North Carolina Department of Health and Human Services and the Tobacco Prevention Control Branch, who's going to do our presentation tonight. So I'm going to hand it over to Ray. Thank you so much for being here tonight.
Thank you. I appreciate that. I'm going to just pull up my presentation here. And I just want to say it really is a blessing to be here with you all tonight. And I really just thank you all so much for taking some time out of your busy schedules, and your interest in learning more about tobacco and how it's impacting both our state, our community, and our faith communities. So a couple of things to get us started. Wanted to just quickly review our learning objectives for tonight. Here they are. Of course, the hope is that, throughout this, you'll comment, ask questions as we go. We're certainly a small enough group. Don't hesitate to interrupt me if you've got a question on something, or maybe I didn't explain something as well as I could have or should have. More than happy to have you do that. And the goal is, of course, to help you all feel comfortable in doing some of these activities that you see listed here on the screen. And, just as a way to support people in your community to have better health and to live the healthiest life that they possibly can. Now, before I get started, I think it's important to just note my use of the term commercial tobacco use, and that's as a way to just differentiate it from sacred tobacco use. We know that for many indigenous communities across North Carolina, that tobacco is considered sacred or traditional. We know that it's been used in ceremony, prayer, and rituals for thousands of years, that it has very unique meaning and significance for different indigenous groups, and can have spiritual, cultural, and medicinal purposes. I say that again as a way to differentiate it from commercial tobacco, which is manufactured by big tobacco companies, is meant for recreational use, is sold for profit. It only benefits tobacco companies and contains thousands of chemicals which are known to be harmful to one's health. So this distinction between sacred tobacco and commercial tobacco is a significant one to make. And throughout this presentation, I may just use the term tobacco. And I want to make sure it's known that as I do that, anytime I do that, it is in reference to commercial tobacco and not sacred tobacco. So, what do we know about the burden of tobacco use? First, looking at sort of a more broader scope, we know smoking has been called the persistent epidemic. And why is that? Because unlike a lot of other health epidemics, smoking and the health effects caused by smoking have really been part of the American experience really since the beginnings of our nation. And for some reason, my slide wanted to skip ahead. And we know that over time, science has shown that folks who smoke cigarettes are much more likely to develop and ultimately die from certain diseases than the folks who don't use tobacco. And despite the Surgeon General's warning back in 1964, since that time, over 20 million Americans have died from smoking. Most of these deaths were of adults with a history of smoking, but there are 2.5 million who were non-smokers who died because they breathed the air that was polluted by other people's cigarette smoke. And, despite these really sad and sobering numbers, smoking is still the leading cause of preventable disease and death in our nation. What are those things? Well, in terms of the impact on the body, well, we know that using tobacco can harm nearly every organ in the body. And it's known to cause 13 different kinds of cancer, and certainly may contribute to more. We're discovering more and more every day. And you can see here the types of cancer listed out on the left side of the body map. But we also know that tobacco use is a high risk factor for many other chronic diseases that affect people in our communities. These things include heart disease, stroke, diabetes, vision problems, and a whole lot more. So, I'm sure you're taking a minute, taking a look at this list on the right side of the body map that shows sort of the chronic diseases that tobacco use can lead to. What we know overall is that folks who smoke are in general in poorer health than folks who don't, and that tobacco use reduces both quantity and quality of life. So you can see from this graph here that smoking causes more deaths each year than alcohol, AIDS, homicide, suicides, moving vehicle accidents, and illegal drug overdoses combined. And to me, this is a mind-boggling statistic. The first time I saw these latest numbers, I didn't think it was true, but it certainly is. And part of the problem is that with tobacco is that it contributes to some of our biggest killers that we saw on the previous screen: the heart disease, cancer, diabetes, lung diseases like emphysema, COPD. And to put this in a little bit of context, 480,000, that's approximately the population of Raleigh. So each year, smoking kills as many folks that live in Raleigh on a yearly basis. Now, more specifically here to North Carolina, taking a look at first some of the health burdens that we see. 14,200 adults who die from their own smoking, 180,000 kids alive today under the age of 18 that will die prematurely from smoking. And again, what I just said is listed on the bottom. Now, so that's the health burden. As if that wasn't enough, there's also an economic burden that comes along with tobacco use. Listed out on the screen there, healthcare costs, Medicaid costs, all of these things. It's what it costs our state. And keep in mind that these numbers are just from smoking cigarettes. They don't take into account all of the new emerging products. They don't take into account, other forms of tobacco. And as we know, there are many different types of addictive tobacco products, not just cigarettes. There's cigars, little cigars, cigarillos, e-cigarettes, chew. You see the screen here just full of several different products. And when, I guess thinking about it, I think a just society sort of ensures that no person, right, regardless of age, race, ethnicity, income, or place of residence, is exposed again and again to experiences that we know are dangerous. Yet, what we see is, current policies, oftentimes allow tobacco companies to say saturate some communities with tailor ads, to allow them to offer discounts to their deadly products. And all of this really, it exposes the residents of these communities to more dangerous tobacco products, and of course, all of the health problems that come with that. So, for example, to put a little context around some of what I'm going to be talking about, research has shown that the proportion of Black residents in a neighborhood was a better predictor of how much tobacco advertising is present in a local store than any other factor, like even the size of the store itself. Right. And of course, much of this advertising is for menthol brands. Is it a surprise then that, of African Americans who use tobacco, 80 to 85% of them use menthol products, mentholated products. Um, you know, Tobacco companies, reward young social media influencers to promote their addictive products online to millions of young followers, without disclosing that they're engaged in any sort of paid advertising. And all of this has an impact. The more ads that folks are subjected to, the more normal the use of these products may become. And there are some studies that show that the number of advertisements that an individual is subjected to is actually a greater indicator of their likelihood to smoke in the future than, say, even if they had a family member who was a tobacco user. Now, when it comes to sort of traditional combustible cigarettes, some good news in some respects. The past few decades, the rates of cigarette smoking, have steadily declined in the United States, and certainly are now at a historic low. What this shows in particular here is the number of youth smoking cigarettes. The problem, though, is that the burden of combustible tobacco use in the U.S., still remains high within some populations. So, although overall adult cigarette smoking is going down, the data shows that, again, there are some populations more likely to smoke than the general population, right? And when we see this is what we oftentimes refer to as a health disparity. And disparities are sort of they're drivers that affect different groups because of differences in their lives. So those who are low income, don't have as much formal education, young adults 18 to 24, African American, American Indian, or Hispanic residents of North Carolina are more likely to smoke than the general population within the state. We know there are also high cigarette smoking rates among folks with behavioral health issues, mental illness, substance use disorder, folks with disabilities, people who are currently dealing with joblessness, and folks who identify as LGBT. So the question is really, how does this set of disparities happen? We know that the United States has steadily sort of expanded tobacco protection since 1964, when that first Surgeon General's report came out on the dangers of cigarette smoking. We know that there is less smoke in the air. There are fewer ads for harmful products, these sorts of things. But these protections, which I think a lot of folks now take for granted, are just less likely to cover the places where people of color live, learn, work, and play, for an example. And this helps to explain why tobacco-related diseases now disproportionately affect some of these same communities that we see on the screen here. We know that folks that have been historically marginalized are more likely to be targeted by tobacco companies with some of those things that I mentioned, the tailor ads, the discounts, the flavored products. They're more likely to be exposed to secondhand smoke. They're less likely to have, say, a healthcare provider sort of offer them advice or treatment for nicotine dependence, or they're even less likely to have health insurance that maybe covers the kind of health support that helps people to quit and to stay quit. We also know that unfortunately they're more likely to experience severe and chronic stress, which can, as we know, have a toxic effect on health. And these factors, can build up, of course, compounding health problems in groups already facing other forms of inequality. And our hope is that, the work you're doing in your faith community or even in your broader community, you can reach people who are more likely to be missed by some of the policies and programs that we've had and have implemented in the past. So, tobacco companies pretty smart. They see that combustible traditional tobacco use is declining, right? So what they do, and it's kind of like playing whack-a-mole, right? You start turning the curve on one, only to have another product sort of pop up. And the tobacco product landscape is ever evolving with new products that really just deliver nicotine in a variety of ways, right? And these sort of newer tobacco products, oftentimes, what we're seeing, they're smokeless. Some contain tobacco, others do not contain tobacco, but still contain nicotine or synthetic nicotine, which is addictive. The products are attractive to children and teens, right? With their colorful packaging, their pleasing flavors, right? And getting those young folks addicted early is really key, right? Those are future customers that they are pulling in. Also, these products, a little bit more discreet, right? They might not produce the clouds of smoke or require spitting. They're more easily concealed, or they may dissolve under the tongue or chewed. All of these things. We see some here, a few of these products, we've got e-cigarettes, some of the popular brands, the Esco, the Puff Bar. We've got heated tobacco products like IQOS. We've got pouches like Zyn. Been in the news a lot lately. And chewing gum, nicotine chewing gum like Lucy, that comes in a whole variety of fruit and dessert flavors. So, when it comes to youth, since I was talking a little bit about them already, here's a list sort of showing some of the most used tobacco products by our middle school and high school students here in North Carolina. And as you can see, our teens are most likely to use electronic cigarettes. Probably doesn't come as a surprise to many of you on the call. 10 years in a row now, e-cigarettes have been the most popular nicotine delivery device used by young folks. And these products, contain nicotine, which is, one of the most addictive substances on the planet, and is also known to harm the developing brain. And since human brains are still developing until around the age of 25, it's really important to sort of keep our kids off of all tobacco products, right? The types of harm that nicotine can cause include things like problems with learning, with memory, with behavior, and it makes them more likely to future addiction issues, to other substances. Sort of creates that neural pathway, if you will. And again, electronic cigarettes by far the top product with youth tobacco use, with cigars and cigarillos, of course, being number two. The one unique thing I think that they both have in common, of course, is the variety of flavors that they both come in. Again, all those dessert flavors and fruity flavors. So, what we know, of course, is that, if we can get to young folks early, we can keep them from ever, using tobacco, because 95% of tobacco users, or 95% of adults who use tobacco products started doing so before they turned 21. And that, a lot of these folks who use these products sort of transition from experimental use to regular daily use between the ages of 18 to 21. And it's just one of the reasons why at the state level, we've been working on sort of just educating folks on the benefits of raising the legal age to purchase tobacco products to be 21. Because, I mean, the bottom line is, I think, from my perspective, is to just, to advance sort of the ideal of justice, right? We need to pay attention to how the tobacco industry, sort of uses flavored additives to sort of entice new users, right? And how this contributes to health disparities. And whether we're talking about, blue raz or sour apple, or just, a mentholated product, right? The tobacco companies use these flavors, to appeal and to lessen the harshness of tobacco products to the users. So, and what the statistics show, particularly for our young folks, 2021 North Carolina data showed that 91% of high schoolers and 96% of middle schoolers who use e-cigarettes are using a flavored product. So, and again, just to say a little bit more, to give some context to this, tobacco companies discount menthol cigarettes more often near schools that Black students attend, right? To reach kids in rural communities, smokeless tobacco brands sponsor rodeos, where studies show up to 30% of the audience are children and teens. The tobacco industry more recently spending billions of dollars to market their products as being part of the LGBT plus culture. Things like sponsoring pride events to advertising like rainbow colored packaging, much like they've traditionally done in the African American community, sponsoring things like jazz festivals, that sort of stuff. And the good news is that, of course, there are steps that we can take, and I'll get into some of that a little bit later. But, just real quickly, one of those things is like, banning the sale of tobacco within, say, 1,000 feet of a school, or a house of worship, or a daycare, or any place maybe where youth may congregate, right? Or just restricting the ability of tobacco companies to sponsor some of these cultural events that I've already mentioned. So to say a little bit about e-cigarettes, as we know, the most popular product being used by our youth in all their various forms. Important to point a few things out. The industry calls what comes out of these products vapor, or they call them vapes. Right? They've done a really good job of sort of framing this in a way that makes it seem less harmful, right? Because the bottom line is it's not really a vapor, right? Vapors, what comes from boiling water, right? It's what's what comes out of your teapot that's on your stovetop, right? But what comes out of an e-cigarette is really an aerosol, which is a cloud containing chemicals. And this aerosol contains some of the same chemicals that we see in cigarette smoke, along with some different ones, of course. And we've already talked about nicotine, its addictiveness, its effects on the developing brain. But heavy metals, fine particulates, VOCs, the volatile organic compounds, in these e-cigarettes are known to cause health problems, things like cancer and heart disease as well. And the bottom line is we're not just sure. We're just not sure what other compounds in e-cigarette aerosol, what sort of problems they may cause in the future. And oftentimes, as I'm going out talking with young folks, or I've got two young boys, 13 and 16, right in this demographic. What I'm telling them is, don't you don't need to be sort of the lab rat, if you will, for these companies. They may be telling you, it's not so bad, but the tobacco industry doesn't have a really good track record when it comes to telling the truth about the health impacts of their products. And I certainly don't want my boys or any other young person in this state or in this nation to sort of serve as that lab rat. And to say a little bit more about e-cigarettes, I think this is a really important thing to point out, right? Our biggest concern with, say, like pod-based e-cigarettes among young people is that they can deliver up to about the same amount of nicotine released from, say, 1.5 to 3.5 packs of cigarettes. So, what so for example, Juul pods, puff bars, Eon sticks, some of the newer disposable products. These are products that are salt-based nicotine. This is nicotine that has been created in a lab. It's not derived from the tobacco plant itself. And what they've been able to do in the lab with this synthetic nicotine is they've been able to manipulate the pH level. Nicotine in and of itself is a really harsh and stringent sort of chemical or compound that is pretty rough on the throat. What they've been able to do is to decrease those things in the synthetic nicotine. Of course, what then allows them to do is to greatly increase the nicotine level that you see in these products. So again, what we're seeing is, anywhere from, like I said, 40 milligrams of nicotine to 68 grams of milligrams of nicotine. And for comparison's sake, a pack of cigarettes contains 20 to 22 milligrams of nicotine. So about 1 milligram of nicotine per cigarette. So these new products are really packing a punch when it comes to the amount of nicotine in them. So, really, pretty unbelievable. If we go back to, say, the first generation of these e-cigarettes, what they were able to do is to max out at about 25 milligrams of nicotine. Again, that was what they were pulling from was derived from the plant itself. These newer products, all synthetic. So, what we see, we've got this high amount of nicotine, right? We know it can be intense for first-time users. And the concern is, and what we see play out here in North Carolina and really across the country, is that young people are now being introduced to a high amount of nicotine. They're developing a tolerance quickly, and they're becoming addicted that much quicker as a result. So it's really, somewhat of a perfect storm, right? We've got less harsh on the throat, right, due to the use of these salt-based nicotines. We've got increased amount of nicotine being delivered to the body, coupled with, enticing flavors. It's really a recipe for addiction. Really, really serious public health problem that we are facing here in North Carolina and across the country. And as an aside, of course, there's also an environmental impact because these disposable products, are meant to be thrown away. Now, the problem with that is, there's a lithium battery that's inside these, which is used to heat up the e-liquid, right? These lithium batteries, can't just be disposed of, right? They're kind of dangerous, right? You can't fly with them because they've been known to sort of explode, if you will. So a major fire hazard. They can leak out. These products, nicotine in and of itself is an acute hazardous waste. And can cause sickness. You can get Nick sick. It's easily absorbed through the skin. So if one of these is down on the ground or there's a bunch, you're picking it up. It can leach into your skin. It can make you sick. For younger kids or for babies who may have access or pick these up. It can cause some serious health issues. Not to mention that this can leach into the ground and the impact that can have. So just another thing to consider when it comes to the use of these new e-cigarette products. Now, again, some of the health effects, along with the harms from nicotine on its own, we know there are health effects from these products, right? We've got the e-cigarette aerosol, it enters the lungs, it leaves chemical residue behind, right? So, I mean, it's heating up a liquid, right? It heats up that liquid, it turns it into smoke, we inhale it, and then guess what? That liquid isn't heated up anymore, and it sort of coats the lungs, right? That's kind of what happens. So, what happens then is the lungs cannot break down, chemicals, damage air pathways, the air sacs that bring oxygen into the body, all of that. And over time, this increases the risk for lung disease, right? We also know that the aerosol has been shown to damage specific parts of your circulatory system, your blood network, right? So increases your risk for heart disease. We know ear, eye, and throat irritation, of course, is common among folks who use e-cigarettes. We also know that scientists are still studying sort of how these aerosol chemicals sort of impact the brain. And, quite frankly, we're only beginning to understand sort of the long-term health effects of using these products. We know how long it took, over 25 to 30 years, to see the long-term health impacts from smoking tobacco cigarettes. Because the damage done on the body isn't always noticeable right away. So, like I said, every chemical found in an e-cigarette aerosol hasn't been studied in detail, and researchers haven't identified every harmful substance in the aerosol, but some have been, and some of these are known to cause cancer. So, just when it comes to the dangers of these products, wanted to point that out. So, from a public health perspective, there's also some concerns with the popularity of these products, right? You see that listed on the screen there, the introduction of nicotine. There's a potential for graduation, which we see an awful lot of dual use, right? People using multiple types of products, whether that's, smoking a cigarette, an e-cigarette, they're, popping a Zyn or a snus or, whatever it may be. Right. We also know the harmful effects to the adolescent brain, and it just really, it renormalizes smoking, right? I mean, after seeing fewer and fewer people, sort of using tobacco products, e-cigarettes have sort of led to seeing that more and more. So, a lot of different public health concerns that we're grappling with and in dealing with when it comes to some of these newer products. So that's from a user perspective, right? But we know, as I highlighted earlier, that not all of the damage done, is to the user, right? And this is where we talk about the dangers of secondhand smoke in e-cigarette aerosol. And another body map, What we know, secondhand smoke, that's the smoke that comes from a lighted cigarette, tobacco product, or is exhaled, right, by a smoker, from a cigarette, a cigar, pipe, an e-cigarette, all of that. And that secondhand smoke is the third most common cause of lung cancer after smoking and household radon. And there's no safe exposure to secondhand smoke, even outdoors. And this is particularly true when it comes to children and unborn babies. So, you can see here this body map, the secondhand tobacco smoke causes, specific health in both children and adults. And when we're talking about ear infections, particularly for middle ear disease for children, it's not just ear infections that we're talking about. It's really long-term ear problems that can arise from that. Of course, frequent and worse asthma attacks, all of that. We know the impact it has on adults as well. And because of the various health problems, on the body map that we just looked at, secondhand smoke kills more than 42,000 non-smokers a year in this country. Of those 42,000, more than 1,000 of these deaths are babies who die from sudden infant death syndrome or other health conditions caused by smoking in the home or during pregnancy. Right. And, the bottom line is that secondhand tobacco smoke causes health problems, some of which are deadly. And secondhand smoke is also proven to be harmful to your pets. It can give your pets cancer, much like it does to humans. So, part of I think talking about secondhand smoke, right? I think smoke-free air policies are really critical public health measures, right? From keeping deadly chemicals out of the air we breathe. Unfortunately, these protections aren't equally available to everyone, right? Leaving just some groups exposed to more secondhand smoke than others, right? And this isn't fair, especially since I think the groups that tend not to be protected also experience other forms of injustice. People of color, members of the LGBTQ plus community, people who face economic inequality are also more likely to be exposed to secondhand smoke. And we know that income inequality is linked to sort of unequal exposure to secondhand smoke. And some of that may be, you see what's on the screen there, an example, right? Folks who live in apartment complexes, say that allow smoking, certainly are exposed to more secondhand smoke than people who live in detached homes, because smoke can travel through vents, through doors and windows, right? And sort of helps explain why children of lower income parents are exposed to more secondhand smoke. And there's been some research done that compared different groups of children who live in homes where no one smokes indoors, right? Nobody's smoking. What they found is that kids who live in multi-unit housing had a 45% higher level of cotinine. That's a marker of recent nicotine exposure that can be detected with a blood test. So 45% higher level of cotinine than children who lived in single family homes. Nobody in the apartment, nobody in the house smoked, but yet 45% higher level of cotinine. So, like I said, the good thing is we know what works, right, to effectively lower tobacco use among the general population, among youth, historically marginalized populations, all of the above, right? And together, these evidence approaches, evidence-based practices that you see here on the screen, are what work to prevent initiation of smoking and other tobacco use, that help to eliminate exposure to secondhand smoke, and that help tobacco users who want to quit and to stay quit. So when it comes to cessation, right, we know that tobacco dependence is a chronic condition, and it oftentimes requires on average 5 to 7 different quit attempts, right? And each sort of attempt is practice, right? Folks get better at it and better at it. But we know what works best, right? And that is medication, combined with counseling doubles people's success rate in helping them to quit. Right. So what do I mean by, medication? Well, there's a couple different ones. You see up on the screen there, the 7 FDA approved medications. The first 1, 2, 3, 4, 5 are you can buy over the counter. The last two you do need a prescription for. But we do know that is what works best. But unfortunately, I don't think enough people know. Like oftentimes people say, yeah, I'm going to try and quit, and they're trying to quit cold turkey, the least effective way to quit. Right. So one of the things that we want to be doing is to make sure folks know, the most effective way for them to quit smoking, something that each and every one of you can share in your health ministries at your place of worship, right? We've got some resources, right? We've got the North Carolina Quit Line, which can hook you up with some of these things, put you in touch with a counselor. We've got texting programs. We've got online. It can be phone based, whichever the user most prefers. We've got specific programs designed for folks with behavioral health issues. African Americans, American Indians, pregnant women. So very specific conversations that can be had. In addition to that, when you call the Quit Line, everybody's going to get some resources to help them. This outlines those resources that are available. The NRT, the nicotine replacement therapy that we see there, sort of the nicotine patches, the gum, the lozenges, we usually get to the caller within a few days, 3 to 5 days. It's a fairly quick turnaround. So that's always a good thing. But this shows you sort of what the coverage may be for folks who are calling in to the Quit Line. Well, we do have a lot of places here in North Carolina that are smoke-free and tobacco-free. Of course, our restaurants and bars went smoke-free 10, 12 years ago now, which is really good. But there are a lot of other places where we have tobacco-free environments here in North Carolina. This sort of lists them out for you. I'm not going to go into great detail, but also North Carolina government, they do have the authority to regulate smoking in these areas. And if that is something that you're interested in, above and beyond maybe taking your Faith Campus tobacco free, if it isn't already, there's some broader work that you can do out in the community. And of course, there's lots of resources out there to help you in doing this, including regional managers. We've got a team of folks out there working in the communities directly to help assist you in any way, shape, or form, to help answer any questions you may have. These are subject matter experts who know what they're doing. And undoubtedly, I believe could be great help if this is something you're looking at doing a little bit more of. But I'm going to stop there. I'm going to stop sharing. I know I said an awful lot, went through a lot of information. Wanted to see if anybody had any questions or comments about anything.
Annie McIver. Why can these products be banned?
I'm sorry, Annie, could you
Why
repeat
can't we ban the products if
why
they're
can't
so
we ban the products? Yeah,
Yes.
it's a great question. So in North Carolina, we are what's called preempted from doing an awful lot of of tobacco work. What that means is it would take a state law to be able to ban certain products. Other states aren't preempted from doing that sort of work, and they certainly are. On the national level, we are really close right now to there being a possible ban on mentholated products. Not going to be able to use menthol as a characterizing flavor in tobacco products. That is in its last leg. It's just a question of when and if President Biden is going to sign that order. So a great question, something we unfortunately can't do at the local level in North Carolina. There isn't the political will to do it at the state level because of the influence of the tobacco companies here in North Carolina.
Thank you.
Well, thank you.
I have a question. I'm a rector at church here in Rutherfordton, and we have some people that are using vaping as a way of trying to quit. And so how do we respond pastorally to people when there's not a need for classes, but a need for one-on-one conversations?
Yeah, so the evidence does show that if you are able to move from traditional combustible tobacco to e-cigarettes, there is a harm reduction step that's being taken. However, it comes with two caveats. Oftentimes what we see are people continue to do dual use, right? They continue to use both products, which of course only makes it that much worse. The second piece to that, and as some of my talk around e-cigarettes pointed out, is the high level of nicotine in e-cigarettes actually makes it much more difficult to quit and wean yourself off of e-cigarettes than traditional cigarettes. So you're moving from one product to another product that we know is still harmful, right? Maybe not as bad, but it's also a lot harder to quit. So that comes with a couple of different sort of pieces to that puzzle. Did I answer your question?
Yes, I'm just trying to see how to respond pastorally when some addictions will cause them not to be able to like serve in a service because they want to go smoke rather than staying for an hour and 15 minutes. They can't go that length of time. So how do you, what sources are out there? Resources are out there?
Great. Yeah, thank you. This is where some of those over-the-counter NRT, the nicotine replacement therapy, can come in. If someone needs that hit of nicotine, you know, they can get a lozenge, they can get some gum, and there are specific ways you have to use those lozenges and that gum, and it's not like you put a piece of gum in your mouth and you chew it like you would a normal piece of gum. That's not how these products work. There are specific ways. So for example, if someone's going to get some nicotine gum, like some Nicorette or something, they chew it up for about 3 to 5 minutes, and then they just stick it right down here in the side of their gum, and the nicotine will sort of go through, be absorbed through the gum line. And that's how if they keep chewing it, it's going to taste nasty. It's not going to work because they're swallowing all of that nicotine rather than it being absorbed into the bloodstream. So making sure they know how to use the product, but utilizing some of that NRT, the nicotine replacement therapy. And that's one of the things, as Donna highlighted, that's available through the tobacco mini grant. You can purchase some NRT to help folks in dealing with their addiction.